Three words. Bone on bone. If you've been told those words, or someone you love has, you know exactly what they feel like. They feel final. They feel like a door closing. எலும்பும் எலும்பும் உராசுகிறது என்று சொன்னார்கள். இனி வேற வழியே இல்லை என்று சொன்னார்கள். Bone on bone, nothing left, nothing to work with. Replace it or live with the pain. That is what most patients are told. Today, I want to challenge that framing. Not to give false hope, but because the framing is incomplete. Bone on bone is a radiological description. It is not a biological prognosis. I am Dr. A.K. Venkatachalam, founder of the Madras Joint Rejuvenation Centre in Chennai. Fellow of the Royal College of Surgeons, UK trained 4 decades in orthopaedics. I have performed knee replacements, bilateral, revision, high friction, gender specific, computer assisted, eye assist. I know exactly what surgery can offer and what it costs. I now practice exclusively joint preservation and biological treatment. Grade 4 arthritis is a question I'm asked about most often. Not by patients with early disease, but by the patients who feel they have run out of road. This video is for them and for the families watching alongside them. What grade 4 actually means. Grade 4. Grade 4 is a radiological classification. It sits at the top of the Kellgren-Lawrence scale, the grading system used to describe the severity of osteoarthritis on X-ray. What grade 4 tells you? The joint space has been lost. The cartilage that once separated the femur from the tibia is no longer visible on a plain X-ray. What grade 4 does not tell you? It does not tell you what the subchondral bone looks like. It does not tell you what biological activity remains. It does not tell you what is driving the pain. And it does not tell you what the patient's goals are. An X-ray is a shadow, a flat, 2-dimensional shadow of a complex, 3-dimensional biological system. The X-ray shows the gap has gone. It does not show what remains. When we look at the MRI of a grade 4 knee, we frequently see something the X-ray cannot show. Bone marrow lesions, subchondral edema, areas of active biological pathology inside the bone beneath the cartilage. Those lesions are not inert. They are active, painful, and in many cases, they are the primary source of the patient's pain. And they can be targeted. The X-ray shows the gap has gone. It does not show what remains or what is driving the pain, what the international evidence now says. For a long time, grade 4 was considered outside the scope of biological treatment. The thinking was straightforward. No cartilage, no target for regeneration. That position is now being formally revised by the highest level of international expert consensus. In 2025, the ESSKA-ORBIT consensus was published. ESSKA, the European Society for Sports Traumatology, Knee Surgery and Arthroscopy. ORBIT, Orthobiologics, Research and Biologics in Treatment. 77 leading European experts in regenerative orthopedics. A formal, structured consensus process. Their conclusion on grade 4, cell-based therapy can provide meaningful clinical benefit even in selected grade 4 patients. This is not a fringe position. This is not a promotional claim. This is the conclusion of 77 specialists published in a peer-reviewed consensus document in 2025. They are precise about 2 things. First, The results in grade 4 are inferior to those in grade 2 and grade 3. That is honest, and I will repeat it in this video. Second, the option is real. For selected patients with appropriate selection, the option is real. The ESSKA-ORBIT consensus 2025, 77 European experts formally recognizes that cell-based therapy can provide meaningful benefit even in selected grade 4 arthritis patients. Why grade 4 pain is often a bone problem. To understand why biology can still help in grade 4, you need to understand where the pain is coming from. The conventional assumption is grade 4 pain comes from bone rubbing on bone. The cartilage is gone, the surfaces are raw, that is the pain. That assumption is incomplete. A significant proportion of grade 4 pain, in many cases, the majority of it, comes not from the joint surface but from inside the subchondral bone. Bone marrow lesions, areas of edema, microfracture, and vascular disruption within the subchondral bone plate. These lesions are explicitly painful. They are pressure sensitive. They are responsible for the night pain, the rest pain, the deep aching quality that grade 4 patients describe. And here is what matters clinically. Those lesions are accessible not by an intra-articular injection but by direct intraosseous injection under imaging guidance of BMAC. Bone marrow aspirate concentrate. BMAC contains mesenchymal stem cells, hematopoietic progenitor cells, and growth factors that target bone repair directly, delivered into the lesion, not around it. In grade 4 patients with significant subchondral lesions, this is often where the most meaningful benefit comes from. Not from treating the absent cartilage, but from treating the painful bone beneath it. In grade 4, the pain is often a bone problem, not just a cartilage problem, and the bone can be treated directly. Who within grade 4 is a candidate? Let me be precise about who we are talking about. Grade 4 is a wide category. Not every grade 4 patient is a candidate for biological treatment, and I will not pretend otherwise. The patients who are most likely to benefit share a specific profile. The grade 4 candidate. Let me describe a patient I see regularly at MJRC, a woman in her late 60s, bilateral grade 4 on X-ray, significant subchondral bone marrow lesions visible for 3 Tesla MRI. Her dominant pain, deep, aching, worst at night and at rest. She has cardiac comorbidities. Her physician has advised against general anesthesia. Surgery carries real risk for her. Her HbA1c has been brought to 6.1 with her physician's help. Her vitamin D has been corrected. Her hsCRP is within range. Her goals: to walk to her place of worship, to sit cross-legged with her grandchildren, to sleep through the night without waking in pain. She does not want surgery. She wants to know if there is another way. That patient is a Prasad candidate. Not because biology will rebuild her cartilage, but because the subchondral lesions driving her pain can be directly targeted. Because her metabolic environment has been prepared. Because her goals are realistic and achievable. The specific criteria we look for: subchondral bone marrow lesions visible on MRI, a metabolic profile that can be optimized or that is already within acceptable range. A patient who is either unable to have surgery, unwilling to have surgery, or who wants to make a serious biological attempt before committing to replacement. And critically, a patient with realistic expectations. தகுதியான நோயாளி யார் என்பதை தெளிவாக புரிந்து கொள்ள வேண்டும். எல்லாருக்கும் இது பொருந்தாது. ஆனால் சரியான நோயாளிக்கு இது ஒரு வழி. The right grade 4 candidate. Significant subchondral lesions are MRI, metabolic environment that can be prepared, realistic goals, and a genuine reason to explore biology before surgery. I want to speak directly about outcomes because this is the section where honesty matters most. In grade 2 and grade 3 patients, properly selected, metabolically prepared Prasad has produced results that have genuinely changed lives. Sustained pain reduction, improved function, patients followed for 8 years with maintained benefit. In grade 4, the results are more modest. The ESSKA-ORBIT consensus is explicit on this. Outcomes in grade 4 are inferior to earlier grades. What we realistically aim for in grade 4? A meaningful reduction in pain, particularly the subchondral deep night pain, improved walking tolerance, better sleep, a reduction in analgesic load, a period of functional stability that may delay or in some patients avoid the need for replacement. What we do not promise in grade 4? Cartilage regrowth, a return to the joint of 10 years ago, a cure. No ethical practitioner can promise those things, and I will not. What I can say is this: for a patient who cannot have surgery or who is not ready to commit to it, a meaningful reduction in pain and an improvement in daily function is not a small thing for that patient. It can be the difference between a life lived in pain and a life with enough comfort to matter. In grade 4, we aim for meaningful pain reduction, better function, and a period of stability. Not a cure, but not nothing for the right patient. In grade 4, metabolic preparation is not optional. It is more important than earlier grades because the biological environment is more challenged. The joint has less to work with, which means everything the patient brings to the treatment, their blood sugar, their vitamin D, their inflammation level, their metabolic health, matters more, not less. I have dedicated videos to this. The links are in the description. Please watch them before any consultation. For grade 4 patients at MJRC, we apply the same 4 marker assessment: HbA1c, triglycerides, vitamin D, HSCRP. The traffic light system applies as strictly here as it does for grade 2. If the metabolic environment is not ready, we do not proceed. We work with the patient's physician to correct what can be corrected. Only then do we treat. A grade 4 patient whose HbA1c is 9.5 is not the same patient as a grade 4 patient whose HbA1c is 6.1. The joint grade may be identical on the X-ray. The biological candidacy is not. In grade 4, the metabolic preparation matters more, not less. Less biological reserve means every variable in the patient's environment carries greater weight. Let me be equally clear about who is not a candidate. A grade 4 patient with severely compromised metabolic health that cannot be corrected within a reasonable time frame is not a candidate. A grade 4 patient whose primary goals require the function of a replaced joint, heavy physical work, return to sport, high demand activity is a patient for whom surgery is likely the more appropriate answer. A patient with active joint infection, severe clotting disorders, or active malignancy affecting the joint is not a candidate, regardless of grade. And a patient who comes to biological treatment with the expectations of a surgical outcome, the consultation at MJRC is not a formality. It is a genuine clinical assessment, sometimes resulting in a recommendation for surgery. And when that is the honest answer, I will say so. If surgery is the honest answer, I will say so. The consultation at MJRC is a genuine assessment, not a formality. If you have grade 4 arthritis or someone you love does, I want you to hear this clearly. Bone on bone is not the end of the conversation. It is the beginning of a more careful one. The question is not, is grade 4 too advanced for biology? The question is this particular patient with this particular MRI, this particular metabolic profile, and these particular goals someone who can be meaningfully helped by a targeted biological approach. For some grade 4 patients, the answer is yes. For others, it is not. And knowing which is which requires a proper assessment. இறுதி முடிவு எடுப்பதற்கு முன்னால் ஒரு முறையாவது மதிப்பீடு செய்யுங்கள். If you want that assessment, reach out. The consultation link is in the description. We see patients from across India and from around the world. The initial consultation can be done online with imaging and blood results shared in advance on Arthritis. If this video gave you something to think about, please subscribe. Share it with someone who needs to hear it and leave a comment below. Tell me, have you been told grade 4 is beyond biology? I read every comment. Bone on bone is not the end of the conversation. It is the beginning of a more careful one.